Dr. Scott Fuller here. I'm going to talk about the brain and making your brain healthier, trying to improve your mental, emotional state, physical body, and so forth. I'm going to talk quickly about omega-3 fats and your omega-6, omega-3 fat ratio. I've touched on this in other shows, but I want to suggest to you that you get your ratio tested. It is something that if you ask your doctor about, they might not know exactly what you're talking about, but it's pretty straightforward stuff. And the tests are very easy. It's something I do in my office. It's a finger prick test in many cases. You can just prick your finger, put it on a pad, send it to a specialty lab, and you get this ratio. The ratio is a sign of inflammation. Inflammation is a word that a lot of us hear about right now. If you have anti-inflammatory things going on in your life, including chiropractic care and good diet and reducing stress and more water and regular physical exercise and enough sleep and using a low-level laser, all these anti-inflammatory things that I talk about, then you're going to have a body that's going to just work better. If you're living in an inflammatory cesspool of toxins and so forth, and you're not helping that with poor diet and being chronically stressed and not getting your spine and nervous system checked and so forth, and knowing your omega-6, omega-3 fat ratio, then you're not going to have as much of an outcome that you're looking for. Okay? So one sign of inflammation is looking at that omega-6, omega-3 fat ratio. Omega-6 fats are inflammatory. Omega-3 fats are anti-inflammatory. Omega-6 fats are warm weather vegetable oils, among other things, but that's the biggie. And that basically is all of them. Okay? So corn and soy and cottonseed and canola and vegetable oil and shortening and margarine and everything that we were told in the past that was better than saturated fat has really skewed this omega-6, omega-3 fat ratio. 119 years ago, at the turn of the last century, about 1-to-1 is what that ratio is, and it was back in the deal before we started messing with food. So 119 years later, we realize if you have that ratio about 1-to-1, omega-6 to omega-3, maybe to 3-to-1, omega-6 to omega-3, that's the safe range. That's about where you want to be. If you're anywhere like 15-to-1, that really is at the risk of a chronic disorder of some sort in your body. Average American, 25-to-1. I've tested lots of my patients. The best I have seen is 6-to-1 without somebody already supplementing and cleaning up their diet. That's the best I have seen. I have seen no one better than that, except for me. I'm doing okay. I'm about 2-to-1 myself. But I was doing a lot of work before I got tested, okay? So that was kind of an unfair advantage. I've known about this anti-inflammatory protocol for 20 years and doing the appropriate supplementation and doing fairly good at my dietary intake and so forth, okay? The worst I've seen in my office is over 30-to-1. So I present this to my people and I said, look, decrease your inflammation by using those essential 8 things that I mentioned a moment ago, and then let's retest that 3 months, 6 months, a year down the road and see where we are. A couple of things from a couple of authors of the importance of getting this ratio straight. This is Dr. David Perlmutter, the medical neurologist out of Florida that has wrote several excellent books. This one is out of his book, Brain Maker. Brain Maker, great book. Go and read it. Really good stuff. When I think about our soaring rates of depression, says Dr. Perlmutter, I wonder about the impact of our sedentary lifestyles and diets that are loaded with pro-inflammatory sugars, too many pro-inflammatory omega-6 fats, and too few anti-inflammatory omega-3 fats. Dr. David Perlmutter, medical physician, in his book, Brain Maker. Dr. Mark Hyman, in his excellent book, Eat Fat, Get Thin. Great book. And page 122, he has a section, The Flawed American Heart Association Advisory on Omega-6 Fatty Acids. He talks about how we recommended for decades to shift people over to those inflammatory omega-6 vegetable oils. Let's see, they're talking about Dr. Calder in 2010, who did a lot of research on inflammation. He warned that while linoleic acid lowers LDL, it also makes cholesterol more vulnerable to oxidation, which means the more omega-6 polyunsaturated fatty acids that you take in, the more inflammatory LDLs that you get that causes our artery disease, heart disease, so forth, and inflammation in your brain, and type 3 diabetes of the brain, and so on and so forth, which is Alzheimer's, etc. Okay? So in here, he has a section how excess omega-6 fats affect our health. Too many omega-6 fats cause cardiovascular disease, type 2 diabetes, obesity, metabolic syndrome, irritable bowel, macular degeneration, rheumatoid arthritis, cancer, psychiatric disorders, and autoimmune diseases. That's again when you have too many omega-6s and not enough omega-3s. That's in Dr. Mark Hyman's book, Eat Fat, Get Thin. And again, that's talking about making that ratio better. If we want to have a healthier mental and emotional state, healthier brain, less inflammation in our arteries and hearts and joints and everything else in our body, you get that ratio back. You have to decrease or eliminate, I say eliminate those omega-6 warm weather vegetable oils and get more omega-3s into your body. Remember, my best recommendation is if you're going to take omega-3s from fish oil, krill oil, and so forth, you want to take supplemental antioxidants. More information on that is on YouTube videos, this show, and you can go to my website to read more about that. Last is just a hugely wonderful book by Dr. Dale Bredesen, medical physician, The End of Alzheimer's. I've talked about this book in the past. He has a whole list of supplements. Again, the first thing is you cannot out-supplement a poor diet. If you're eating bad stuff and then you take a bunch of supplements, it doesn't work. No free lunch, in other words. He has a whole list of things that he talks about that are brain-building supplements. B-complex vitamins, C, D, E, K2, resveratrol, nicotinamide riboside, citicoline, acetyl-L-carnitine, ubiquinol CoQ10, PQQ. Then he mentions omega-3 fatty acids, whole coffee fruit extract, and it goes on from there. Then his recommendation about reducing inflammation is improving the diet, but then mentioning that omega-3s help prevent new inflammation. He recommends 1 gram of omega-3s from fish or krill or algae oil, 1 gram. Just as a quick note, if you're going to try to get 1,000 milligrams or 1 gram from krill oil or algae oil, it's going to be difficult to do, but if you're a vegan or vegan vegetarian, go for that. Go for the krill if you're going to do that. Go for the algae oil. I do think the best is omega-3 oils from fish. One little side effect of that is with as many people that we have on the planet and that we farm a lot of fish now, it's going to be difficult to get clean sources of omega-3 from fish, but you do the best you can for now. I'm sure by the time that ocean resources they're already depleted, but when it's going to not make sense anymore to squeeze fish for omega-3 fats, we'll probably have some sort of manufacturing process that allows us to have omega-3s. Of course, nature is always the best source. I'm Dr. Scott Fuller.